Please welcome Jamal Khan, Chief Growth and Innovation Officer at Connection, and Andrew Lay, CEO and co-founder of Buoy Health.
So before we jump into it, I just want to give a quick background on Andrew. Since founding Buoy out of Harvard Innovation Labs in 2014, Andrew has led the company through 2 successful rounds of fundraising, raising over $67 million with prominent healthcare investors. In 2020, Andrew was named by Business Insider as one of the 30 healthcare leaders under 40 to watch. He's also been designated a digital innovator by Employee Benefits News and also by Boston's Business Journal as one of the top 40 under 40 leaders, and recognized also as the TED Med Hive Innovator. Andrew holds a doctorate of medicine from Harvard Medical School and graduated magna cum laude from Harvard College. So Andrew, thank you for being here. It's great always to have these conversations with you. I know we've had a bunch of sessions, but I think for the audience here, it would be good to give everyone a good context around Buoy Health itself, the vision, the idea behind, and especially your personal journey through that process.
I was in my last year of medical school. I was going to go be a neurosurgeon. And the last rotation, I was in the ER. And I kept seeing all these patients who were Googling their symptoms before running to the emergency room and just kind of doing the wrong thing, all the time. For consumers, it's almost impossible for you to shop for healthcare because you have to be like a doctor and an insurance expert rolled into one in real time. So that knowledge gap, you're just very unempowered to do it. And so we built this technology starting in 2014 that talks to you like a clinician. It reasons based on clinical literature. And after about 2 minutes of this back and forth, it looks like you're texting with someone. It helps you figure out clinically what's most likely going on. We launched that in 2017. Today, we have about 30 million users who come to Buoy organically every single year. And then we started selling to insurance companies like United, Cigna, Humana, as well as self-insured employers. So we started to get the insurance angle. And then about a year ago, we actually then shifted into becoming like a full-on marketplace. The vision of the company is, in some ways, to build like the Etsy of healthcare, where now we have digital health companies, individual doctors, practices, pharmacies, over-the-counter medications, built onto Buoy such that as a consumer, you have no idea what's going on. You come onto Buoy, we actually give you the technology to understand what it is that you should pick, what service is right for you, and to do that type of matching. And so we're really trying to replace the shopping component of a doctor's job and allow doctors to care and treat for patients, but really give people kind of the technology to kind of locked in the brains of a select few.
Talk to us about you were going down a very structured path to become a neurosurgeon out of Harvard, but you jumped into the deep end of the entrepreneurial pool. How did you go through that process, and any ideas or thoughts that you can share with aspiring founders in that particular challenge?
Yeah, in the early stages, I think a lot about risk mitigation. So for me, I took a very intentional sabbatical from school instead of graduating and then starting the company, because if it all went belly up, I could just go back to school and then go to residency, and basically there would be no blemish in my kind of track record. And I had a stipend from school. I lived with in a very with very low fixed costs, just trying to save our way to getting an MVP. And so we were just really scrappy, my co-founders and I, just to buy ourselves enough time. I was invited to kind of present what we're up to some donors. I went up there, I had t-shirts and jeans on, everyone else was in suits. It was kind of this hoity-toity, type of event. And I said, I'm sorry that I look this way, just lost all my stuff in a fire, but this is what we're up to. And as I was walking out, someone reached across the table and gave me their card. And turns out this individual, founded a really famous marketing agency, and then went on to be the chairman of Partners, which is a big healthcare system in Boston for a really long time. And when I met with him in person, he was like, what I liked about you is one, you looked like shit, when I saw you, but you kind of had the gumption to just keep going. And he cut us our first big check, and that was what allowed us to grow. And I think the thing that really stood out to me in terms of learning was just resilience. That is the key ingredient to winning.
And if you think back in those early stages when you were doing those initial rounds, are there any lessons that you would like to share with us, or any lessons or perhaps redos that you wish you could do?
One is that very early on, cash is very expensive, and cash is like oxygen. When I think about those things and applying it to what I learned early on, I was, looking back on it, too liberal with my equity. like really focused on getting cash in the door, but cash is just so expensive. So when I talk to founders now, I talk about once you need cash, it really is like a light switch, like 0 or 1. So if you can just prolong the period of time in which your fixed costs are low enough that you can build enough traction to get into later and later stages, you get out of the more expensive phases of cash needs. You know, it's keeping your day job, you know, living with your parents if that's possible, like, you know, don't buy a house, you know, just really stay lean in order to get as much traction as possible. And then, you know, the second learning, going back to this like cash is oxygen, I think, you know, the CEO's job is to have cash in the bank. And when you do decide to flip that switch, I think the paradoxical thing is like when you do raise as much as possible. Once you do need money, the opportunity to raise can go away like that.
But what are some of those things that keep you up at night? Any reflection that you can give, again, aspiring founders, and some of your insights with respect to those challenges as you're now scaling your business to that next level?
Yeah, the scaling thing that keeps me up at night is product market fit. And I think the insight is that product market fit, in my opinion, is a dynamic thing. You can have it and then you can lose it. And I think with scale, and you know, I'm defining scale here as you have more users or you have more clients. As you penetrate a market, you have your innovators, your early adopters, and then you have this massive gap, this chasm, and then you get to the early majority, late majority, and laggards. And so many companies get product market fit in the innovator and early adopters, and then they hit scale, trying to get that next wave of users or clients. But the product market fit in that world is different than the product market fit early. And so they end up dying in the chasm. And so for me, that keeps me up at night because we're trying to get more users, we're trying to get more clients, and we're building a marketplace. So you have two sides to the marketplace. You have two product market fit problems. You could die twice in two chasms.
But if there's one consistency in each of these elements, though they're pretty dynamic in themselves, is the team behind this?
I strongly believe that the most important ingredient to a healthy company is trust. I lucked into having 3 co-founders besides myself who just intrinsically trusted each other. I think it's because we had like a shared background in terms of being friends before we started Buoy. And then on top of that though, we did a lot of trial and error. We figured out that there were certain people who just didn't fit in our journey over time. And so we have these 5 core attributes at Buoy. Being kind, being a linear communicator, being gritty, intellectually curious, having a growth mindset. So now we have interviewers that are trained to look at all 5 attributes. It's allowed us to scale with like minimal mistakes.